My name is Shanker Pasupathy. I'm a gastrointestinal surgeon, and I've been involved in treating obesity and in weight loss for more than a decade now. The Elipse balloon is a revolutionary new balloon. It's completely different from all the previous balloons because it can be placed without any anesthesia, without surgery or endoscopy. The final kicker about the balloon is that 4 months after the balloon is placed, the valve disintegrates by itself and the balloon completely empties, and then it's just passed out naturally. So this balloon, unlike any other balloon, does not require the patient to come into the hospital at all. Everything can be done on an outpatient basis. Most of the time, people will feel the sense of fullness, as if they just ate something. In fact, for the first time when we place a balloon, the patient will say, "Oh, I feel like I just had a huge meal just after the balloon is placed." So suddenly they feel that the stomach went from empty to full. So the balloon itself, that feeling of fullness that's placed there, right? The body kind of gets used to it after a while, so that you find that you'll be able to eat a little more as the stomach starts to stretch a little bit around the balloon. But there's some limit to how much you can eat. It's also important to maintain a very active routine in your lifestyle routine and be transforming to a more active lifestyle from a more sedentary lifestyle if that is your issue as well. So in 4 months, the idea about 4 months is because that's enough time for us to get used to new habits and new routines. And so in 4 months when the balloon comes out, one hopes that that new routine is already established as the norm for you. So the way we deliver this as a program is actually multi-pronged, multidisciplinary. So the balloon is just the tool. What's important is that we need to learn how to change these habits and also pick out what are some of those culprit habits that need to be ironed out. So normally after we place the balloon, we will also have a very detailed discussion with not just the doctor but also the dietitian and the psychologist to understand what are some of the barriers to why someone is having difficulty in losing weight and changing the way they eat. And this goes on. We normally do weekly discussions for the first few weeks, and then it will be twice a month and then maybe monthly. And this continues for about 6 months. So we think it's very important to have that sort of slow run-in to make sure that those habits can slowly be changed and the new habits can be inculcated. One of the most important things is actually not to try to become someone else, but really to identify what are the things that people get excited about doing, the kind of food that you like to eat. Because I don't think it's about eliminating a whole set of foods just because they are so-called unhealthy. It's just about learning how to have smaller portions, be happy with that, and also mix and match with food that is more healthy and can fill us up at the same time. We would usually aim to lose about 10% of weight. We set that as the target. Now, people have lost 12, 15%, and there are people who've lost even more than that. But 10% weight loss is the target that we set ourselves to achieve as once the balloon is placed in the stomach.